Hello everyone, Dr. Casen and Dr. Bob coming to you from Westlake, Ohio.
And Florida.
Naples, Florida. And we are talking to you about one of the most popular things I think every month, every year, Dr. Bob, and it is women's health. And I know you have been so blessed and we've been so blessed to be able to use your book as a resource for all of these ladies and all of the stories that we hear. And I know that you're emailing us, Facebooking us. We have so many questions on your Ask Dr. Bob, and a lot comes down to the basics, Dr. Bob, of how our body works, and maybe you could be having different body signals in your body right now, whether it's tenderness in your breasts, a heavy menstrual flow, overall maybe difficulty losing weight, or you're tired and
depressed,
depressed,
anxiety, constipation, no energy.
And I was just working with a woman too, veins on her legs, and she's having all of these really, really painful procedures that she's having done. And it all goes to the root of how your body is working or not working. So let's start, Dr. Bob, with the liver and tell us the big idea of how it all works together.
Well, the liver is probably the most important key when it comes to everybody's health, but especially women's health. So this is a model of the liver. This is what a normal liver would look like. Dr. Casen, you want to hold that for me? This would be a fatty liver. You hear so much about fatty liver, and in our practice today, we take film standing up. So we'll see large livers. Your liver should stop around the bottom of your right rib on the right side, the lower rib. And if it extends past that, which we do see, a lot of people's ribs go way down to their abdomen. That's not necessarily a good sign. This is a very severely damaged liver, usually oftentimes from alcohol. We're going to flip the liver over, and I want you to see the gallbladder is there. Now, the gallbladder is a reservoir of bile. Your liver makes bile. So think of bile as your dish detergent in your body, so it emulsifies fat. But if you consume maybe too much alcohol, you're taking a lot of medications, maybe even a lot of fruit, and you're placing a demand on your liver, you'll get thick, pasty bile, and you're going to have potential with some gallbladder issues. Now, Dr. Casen just mentioned about the lady with the vein issue. So this big blue area right here, this is called the vena cava. So we have a superior and an inferior vena cava. So blood flows from your veins up through your liver on the way to your heart. So if this liver is compromised for whatever reason, there'll be a backup, and that is a vein issue, hemorrhoids and spider veins, Dr. Casen.
And then what's really interesting is, okay, I'm going to give this back to you here. When your liver's plugged up, we have this tool in our office called breast thermography, and what happens is if your liver is not properly processing everything, it can actually back up into your lymphatic system, and then we see increased temperature in your breasts as inflammation, fibrocystic tissue. Overall, we also see increased estrogen in your body, whether it's in your breasts or other areas, Dr. Bob. I know
heavy flow, and I think tying this all together, when we talk about women's health, and I wrote Dr. Bob's Drugless Guide to Balancing Female Hormones, I'd encourage you to look at it and get it, because you're going to learn how all these pieces interchange with each other. So this happens to be the uterus, this is the vagina, and these are the ovaries right here. So if your liver is compromised and you have excessive estrogen, you have a greater chance to have a fibroid or a tumor in your uterus. If also, Dr. Casen briefly talked about breast health, we also know that if you don't have enough iodine in your body, you can have cysts on your ovaries. And a lot of times you don't have enough iodine, you're gonna have a low thyroid. Body signals for a low thyroid include cold hands, cold feet, thinning hair, high cholesterol, constipation, morning headache. So we know that all of these organs are so important and they interchange with each other.
And it starts at a young age. So you might be thinking, oh my goodness, I have a daughter or a granddaughter. And when we start working with our kids in our office, it's amazing when a female first gets her menstrual cycle. if she has a irregular cycle or tender breasts or a heavy flow, Dr. Bob, the traditional solution for a young girl like that is to be put on some type of birth control.
And that just compounds the problem, and they'll never get off of that. So we know that the liver is really important. If you live anywhere in the United States and you can't have it, if someone's not willing to service you, you really should come and visit us either here in Westlake or in our Naples office, and we take our film standing up. This is so important. Now, a couple other thoughts when it comes to women's health. We see a lot of ladies today that may have issues, and it's not just women, but with depression and anxiety, especially postpartum depression. That means after you have your baby. Well, we all do a blood test called the Omega test, and one of the oils we look for is DHA, because your oils are depleted, especially after baby number 2. And we have seen that you can have depression issues because of the wrong oil. And we also talked a little bit about the thyroid gland and iodine. So let me give you this, because I also wrote Dr. Bob's Drugless Guide to Mental Health. The adrenal glands make adrenaline. Your body uses something called tyrosine, which is an amino acid, to make adrenaline. Tyrosine is a natural antidepressant. Tyrosine and iodine make thyroid hormone. So you could have adrenal stress, low thyroid, and depression all wrapped up in one because of stress. And Dr. Casen, myself, and Dr. Anthony, our combined time working together on the planet, we have over 65 years of experience. And all three of us will tell you the last year has been the most amazing year in our practice, because these people have all kinds of stuff because of anxiety and worry. And anxiety and worry, by the way, impacts the spleen. The kidney is fear, lungs are sadness. So you can have a cough and you have sadness, but you could have anxiety and worry, which impacts the spleen, which impacts the lymphatic system. It's a big puzzle, isn't it?
It is. And the good news is we're your puzzle solvers. So I know all these body signals, you're watching us, you can rewatch us, but the great news is, even in the last year, Dr. Bob, it's so amazing to see kids and families improve without drugs.
Without drugs.
Through chiropractic and nutrition and some love. A lot of you, maybe you just need some more love in your life and someone to really go step by step with you.
We do hug. So we've hugged a lot of people that really have needed it because they don't know where to go. So we're here to help you. I'm Dr. Bob DiMaria. This is Dr. Casen DiMaria. Look forward to seeing you in our office. Thank you so much.
Bye.